Hello and welcome to the ASCO Guidelines podcast series, brought to you by the ASCO Podcast Network, a collection of 9 programs covering a range of educational and scientific content and offering enriching insight into the world of cancer care. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today I'm interviewing Dr. Jun Mao from Memorial Sloan Kettering Cancer Center in New York, New York, lead author on Integrative Medicine for Pain Management in Oncology, Society for Integrative Oncology, and American Society of Clinical Oncology Guideline. Thank you for being here, Dr. Mao.
Thank you, Brittany. It's great to be here.
First, I'd like to note that ASCO takes great care in the development of its guidelines and ensuring that the ASCO conflict of interest policy is followed for each guideline. The full conflict of interest information for this guideline panel is available in line with the publication of the guideline in the Journal of Clinical Oncology. Dr. Mao, do you have any relevant disclosures that are directly related to this guideline topic?
No, I don't.
Great, then I'd like to get into the content of this guideline. So what is the purpose and scope of this joint SIO-ASCO guideline?
So, Brittany, about 1 in 2 cancer patients or survivors experience pain that often are not adequately controlled by conventional medications. So often individuals seek out complementary and alternative medicine, more recently known as integrated medicine, for the relief of pain. But there's a very little sort of synthesized information for oncologists to help guide the patients in choose evidence-based integrated therapy approach. Therefore, we decided to really do a systematic review and come up with a system of guidelines that can help oncologists and patients make informed decisions about choosing the right type of integrated medicine approaches to manage pain. The Society for Integrated Oncology and the American Society of Clinical Oncology join forces that really convene a group of panelists that representing many fields in conventional oncology, supportive and integrated medicine. After reviewing over 200 articles from clinical trials to systematic review and come up with very thoughtful recommendations that help patients and physicians to provide the best evidence-based care to manage pain for patients with cancer.
Excellent. And yes, it's great to have SIO and ASCO join forces on this guideline. So then next, I'd like to review those key evidence-based recommendations of this guideline that you just mentioned. The recommendations are provided in the guideline by pain type, so I'd like to review each category for our listeners, starting with what is recommended for patients experiencing aromatase inhibitor-related joint pain.
So we recommend acupuncture should be offered to patients experiencing aromatase inhibitors-related joint pain in breast cancer. And this is really evidence-based, benefits outweigh harms, and with intermediate quality of evidence and moderate strength of recommendation. As many of our audience know that aromatase inhibitors cause very severe type of joint pain that not only affect quality of life and functions, but make many women stop taking these life-saving drugs. So the panelists want to recommend this therapy based on large randomized control trial that hope this can be part of a pain management strategy along with exercise or duloxetine. So give people the options so that women can not only have better quality of life, but also hopefully they can stay on aromatase inhibitors so to prevent the recurrence of breast cancer. And we also found some weak evidence for yoga to improve joint pain related to AIs. However, the evidence is weak, although the benefit outweighs the harm, so clearly more studies are needed to make yoga as a part of therapies for cancer patients.
Understood, and thank you for reviewing the level of evidence behind those 2 interventions for patients experiencing aromatase inhibitor-related joint pain. So following those recommendations, what is recommended for patients experiencing general cancer pain or musculoskeletal pain?
So in terms of general cancer pain or musculoskeletal pain, so there are 3 therapies that we consider that may be offered to patients experiencing this type of pain: acupuncture, reflexology or acupressure, or massage. So reflexology and acupressure use the same kind of principles like acupuncture, but instead using needles, but using hands. So sort of that's kind of in between acupuncture and massage. So these are evidence-based recommendations with benefits outweigh harms, and the quality of evidence are intermediate with moderate level of evidence of recommendations. So clearly, for cancer patients or survivors experience this type of general cancer pain and musculoskeletal pain, I think this approaches may be appropriately integrated along with conventional pharmacotherapy or physical therapy.
Definitely. It's great to have options to go along conventional pharmacologic therapy. So then following those recommendations you just mentioned, what is recommended for patients with chemotherapy-induced peripheral neuropathy?
So chemotherapy-induced peripheral neuropathy, also known as CIPN, is a very bothersome symptoms resulted from certain type of chemotherapy that can be very functional limiting and resulting in falls, and also can cut the dosage of chemotherapy. So this is a quite bothersome to patients and also can be really challenging in the practice of oncology. So based on the current evidence, we recommend either acupuncture or reflexology or acupressure may be offered to patients experience CIPM. So unfortunately, the evidence base here is weaker. So although it's evidence based, benefits outweigh harms, but the quality of evidence is low. Therefore, the level of recommendation is weak. So basically, there are a number of smaller trials really provide some good signals that this type of therapies can be beneficial, but we really need more large and definitive trials to establish the strength of the evidence.
Understood. It's important to know in which patient populations we have more evidence and where we still need confirmatory results. So, following those recommendations, what is recommended for patients who experience procedural or surgical pain?
Many surgery procedures or surgery itself can cause acute short-term pain that, if not adequately treated, can then become chronic. So in this setting, there is actually a pretty reasonably robust base for hypnosis. So the evidence base really is intermediate with moderate level recommendation. We consider that hypnosis may be offered to patients experience procedural pain in cancer treatment or diagnostic workups. However, for other type of therapies like acupuncture or acupressure or music therapy, although there are some smaller trials to show that it could be beneficial, but the current evidence base is very low and the weak strength of recommendation is weak. So clearly, we need more high quality trials to establish the evidence base for those therapies for surgery or procedural related pain.
Understood. And we'll get into some of those outstanding questions or where there's insufficient evidence a little bit later in the episode. So then the last category of recommendations that the panel made, what is recommended for patients who have pain during palliative and hospice care?
So for patients with advanced cancer near the end of life, there are some good evidence that massage may be offered for patients experiencing pain during palliative and hospice care. So we recommend massage to be used with intermediate level of evidence and moderate level of recommendation. And I do think the caveat is we still don't know the long-term effects for massage. Therefore, many of the trials, the follow-up are reasonably short. So, but the evidence showing that acupuncture in the population of palliative care hospice patients can produce immediate pain relief as well as to enhance coping. Therefore, we suggest massage may be offered to patients experiencing pain during hospice or palliative care setting.
Understood. Well, thank you for reviewing all those recommendations, the level of evidence behind them, and the strength of those recommendations. But you've also mentioned that in several areas there's low evidence or insufficient evidence. So are there interventions that the panel reviewed but found insufficient or inconclusive evidence to make recommendations?
Brittany, I feel like the field of integrated medicine's research is still in its sort of an infant or maybe adolescency. So there's clearly a lot of gaps, particularly in the area of mindfulness-based interventions. There are studies showing outside oncology setting, it can be very helpful for managed pain and pain coping, but that literature in oncology is very, very limited to make any reasonable recommendation. So I think research is needed. Another area is in the area of herbal medicine or supplements. A lot of cancer patients have a lot of interest in using supplements or herbs to manage symptoms, improve sense of well-being. But the trials, unfortunately, in this setting are just too sparse and the quality are too poor to make any recommendation. Last but not least is for children that experience pain. This guideline was sought out to develop recommendation for both adults and children. Unfortunately, the trials are in the pediatric populations are just too few, and some of the quality are just too poor. Therefore, there's inconclusive evidence in that population to recommend any specific therapy to be used for managing pain. So I do think these represent really important gaps in research that we really need to be developing and designing and conducting rigorous clinical trials to build evidence base so we can bring integrated medicine into conventional oncology care to help patients with a variety of tools.
Yes, well, we certainly appreciate the panel reviewing this mountain of evidence across several different integrative oncology approaches. Even if we ended up not making recommendations for certain interventions because of inconclusive or insufficient evidence, because it still demonstrates the need for high quality trials in those areas. In your view, Dr. Mao, what is the importance of this guideline and how will it change clinical practice?
Bernie, I think this guideline is both important and timely. With the opiate epidemic experienced in the United States, managing pain for cancer patients and survivors are incredibly challenging. This is the first SIO and ASCO joint guideline for integrated medicine for pain. And for the first time, we have solid recommendations for specific integrated medicine modalities to care for patients and survivors with pain. I do think the implementation process will take time. First of all, we need to find ways to educate oncology providers as well as patients about the evidence base of this treatment so they can talk to their patients about this type of therapies. Second of all, some of the therapies are not uniformly covered by insurance. So we do need better insurance coverage for integrative therapies such as acupuncture, massage, or reflexology for managed pain for cancer patients. So people from across socioeconomic areas can access it. I think last but not least, as we know, there are disparity in healthcare infrastructures in large hospitals like Memorial Sloan Kettering Cancer Center, Dana-Farber, or MD Anderson Cancer Center. We do have acupuncture services developed to help cancer patients. But then in smaller community hospitals, especially in those who serve predominantly Black and Brown populations, those services may not be in existence. So we need to partner with our community partners to develop the necessary resources to overcome those structural barriers for these therapies to be incorporated part of standard oncology care.
Definitely. Those are key points on the implementation of this guideline and the availability and accessibility of integrative medicine modalities across different hospitals and patients. So then this leads into my next question. How will these guideline recommendations impact patients?
It is my hope this will really help improve patient care and also patients' adherence to conventional oncological treatments, whether they're chemotherapies or hormonal treatments. I do think patients in general have a lot of preferences for using therapies that are a little bit more natural or therapies are in addition to drugs to manage their pain or symptoms. So this guidelines clearly provided sort of recommendations based on prior research. And I do think as we engage patients in shared decision making, we need to really acknowledge patients' beliefs, preferences, as well as the availability of treatments in their care settings. So hopefully we can provide both evidence-based and patient-centered care to manage pain.
Absolutely. And it's great to have more options beyond conventional treatments to offer patients to help with pain management because it occurs across cancer patients. Finally, Dr. Mao, you've already talked about some interventions where we lack data, such as mindfulness-based interventions, herbal medicine and supplements, and interventions in the pediatric population. But what are the outstanding questions for the use of integrative approaches in managing pain in patients with cancer?
Brittany, as a researcher, I'm always thinking about what the future questions, right? I do think with the clinical trials in the last 10 years, there's definitely larger and well-done trials to demonstrate both efficacy and effectiveness of specific integrated medicine therapies for improving pain. We need to do more of that in the next 10, 20 years. In addition, I think two particular areas of research I hope to see more research as part of the guidelines being implemented. One is what I consider a precision pain management, but just because acupuncture works for some patients, it doesn't work for everyone. We need to figure out what type of molecular biomarkers or psychological attribute can help to predict who may respond to acupuncture or not, so we can make sure the right person get the right care for best pain management and the least amount of cost to him or herself or to the society, right? The second issue I really think we got to do better is I feel like there's a wide acknowledgement of health disparity in pain management, particularly in cancer patients. I would love to see more research designed for and in populations of historically underserved populations so we can really implement these approaches to narrow the health disparity issues in cancer care.
Absolutely. Those are key points about providing equitable care for pain management in oncology. So I want to thank you for all of your work on these guidelines, Dr. Mao, and thank you for taking the time to speak with me today.
Brittany, such a pleasure. Thank you so much.
And thank you to all of our listeners for tuning in to the ASCO Guidelines podcast series. To read the full guideline, go to www.asco.org/survivorship-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, available in iTunes or the Google Play Store. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.